This is a very interesting ECG. So anyone presenting with chest pain, the one of the most important thing which has to be concluded or understood is acute myocardial infarction. Now, to label it as myocardial infarction, there must be more than 2 millimeter ST elevation in chest leads. Chest leads means V1, V2, V3, V4, V5, and V6. There must be at least two or more than two consecutive lead involvement. Means it has to be either V1, V2, or V2, V3, or V3, V4, or V3, V4, or V4, V5, or V5, V6. If it is more than two leads, then it is all good. And it has to be more than 1 millimeter ST elevation. In limb leads, these are all limb leads, which is lead 1, 2, 3, AVR, AVL, and AVF. Now, uh, to say it as myocardial infarction, there has to be ST elevation, and in many of the patients, there can be slight variation of the typical ST elevation. So we can very nicely see either tombstone ST elevation or check mark ST elevation. Check mark is like this, which we used to see signs that yes, we are checked, we are checked, we are checked, we are checked, we are checked. So this is actually check mark sign, which is very commonly used by the teachers to sign. And one of the most important ST elevation or acute MI finding is hyperacute T waves. So hyperacute T waves means usually we don't get very tall T waves. So wherever we get tall T waves, one of the most important thing is hyperkalemia. So I have told this thing so many times. In hyperkalemia, the T wave is tall, it is symmetrical, it is tented, it is peaking. Means the tall T will be like this, a very, very sharp T. So this is tented and peaking tall T, and it suggests hyperkalemia. So if it is hyperkalemia, the second most important thing will be there will be loss of P wave and there will be widening of QRS. These things very commonly suggest hyperkalemia. So whenever we are thinking of hyperkalemia, you should always see whether there is P wave loss or not, and how is the QRS. Here, the QRS is very nice. It is very sharp. So we call it as wide QRS complex if it is more than 120 milliseconds, means more than three small boxes. Here it is hardly involving one or two small boxes. See, one and two small boxes means the QRS is not wide. Here also it is hardly involving two small boxes, so the QRS is not wide. Here also it is involving hardly two small boxes, means it is around 80 milliseconds. So, uh, and each and every QRS has very, very well P wave. It means this tall T wave is not of hyperkalemia. We can very nicely make out the P waves. So there is narrow QRS, there is presence of P wave. So this tall T wave is not because of hyperkalemia. So we can very nicely see that this T is almost as tall as QRS. This T is more tall than QRS. This T is more tall than the QRS. This T is more tall than QRS. So this is a hyperacute tall T waves, which very commonly suggest acute MI. And second thing which we can see is a check mark sign. The sign like this. Just see how is this sign. This is like someone had checked the answers. So this is check mark sign. So this is the check mark sign which suggests that this is MI. This is acute myocardial infarction. So there are two findings which are very, very beautiful. That is check mark sign and hyperacute T waves. And we can very nicely make out ST elevation. See, this is the baseline. This is the baseline of the ECG which is running. And here there is crystal clear ST elevation. there is ST elevation here. See, this is the baseline. This is the baseline ECG that is running, and here there is ST elevation of 1 and around 2. Here, this is the this is the baseline ECG. This is one small box and two small box. So there is two small box ST elevation. Here, this is the basic baseline which is running. This is baseline which is running, and there is crystal clear 1 millimeter and 2 millimeter ST elevation. Here also, it is around one small box and around two small boxes. So there is crystal clear ST elevation, which can be very nicely make out in V5, V4, V5, V6, and in lead 1 and lead AVL. So here ST elevation is by 1 millimeter. Here ST elevation is around 1 millimeter. One V4, V5, V6 usually suggest LCX artery. So V1 to V4 usually suggests left anterior descending artery, and one AVL usually suggests LCX, and one AVL with V5, V6 usually suggests L6 artery, though such findings can be seen in left anterior descending artery also. So this is very nice finding showing checkmark sign, hyperacute tall T waves, and ST elevation, very typical of acute myocardial infarction. And that's all for now. Thank you.